Okay, hi everyone. We'll just give some other folks maybe one more minute and then we'll get started. Okay, guys, it is 2 o'clock, so we will get started. Thank you guys for joining me today for the Healthy Town application webinar. I guess I should make sure that, again, that you guys can all hear me, which is tough because I don't think you can talk. Stacy, I'm gonna unmute you again, just make sure. I seem something to be a little wonky with the Stacy.
Hi, I can hear you fine.
All right, but I'm going to assume that everyone else can as well. Guys, I'm not able to, I'm going to keep you guys muted during the presentation, but you can raise your hand. And then if you're not able to speak when we do the question parts, some people, it seems like maybe we're having trouble letting me know that they can hear me. We'll do that through text, through the question and answer box at the bottom of your screen, and we'll go from there. So I'll take questions at certain points in the presentation, so feel free to jot them down if you have any going forward. All right. So let's see. Oh, some other people joining us. Okay, so we're going to get started. So again, today I'm Julie DeSimone. For those of you who don't know me, I am the program officer of the Mayor's Wellness Campaign at the New Jersey Healthcare Quality Institute. And in today's webinar, we're going to be providing an in-depth review of the Mayor's Wellness Campaign Healthy Town application. Okay, so just a little bit about the New Jersey Healthcare Quality Institute. The Mayor's Wellness Campaign is just one of our programs. We are the only independent, nonpartisan, nonprofit, multi-stakeholder advocate for healthcare quality in New Jersey. We're committed to improving healthcare quality and safety, expanding access to good care, and controlling costs. We believe collaboration is essential to improving healthcare, and that bringing together stakeholders from diverse settings is imperative to meet these goals. So very much in line with the Mayor's Wellness Campaign and that bringing together of stakeholders to improve health and wellness. Our mission is to undertake projects and promote system changes that ensure that quality, safety, and accountability and cost containment are closely linked to the delivery of healthcare services in New Jersey. So as many of you hopefully know, the Mayor's Wellness Campaign has been a program of the Quality Institute for the last 13 years. It is in partnership with the New Jersey State League of Municipalities. I'm sure that I think I met most of you who are registered today at the conference last month. The Mayor's Wellness Campaign is a program that gives mayors tools and strategies to champion healthy and active living and to improve overall health of your communities. We see mayors as local champions of change, and when mayors promote healthy living, they can drive community-wide change. So the Mayor's Wellness Campaign aims to give mayors and their staff and volunteers the platform and tools needed to make their communities a healthier place to live, work, and play. And as part of the Mayor's Wellness Campaign, a town should work to promote health in the following domains, which is youth, seniors, employees, and communities. So the Healthy Town designation is a program of the New Jersey Healthcare Quality Institute in partnership with the New Jersey State League of Municipalities, like I mentioned before. We recognize communities in which mayors have made healthy lifestyles a top priority and are actively engaging all members of their community through inclusive, evidence-based health and wellness programming, policies, and a culture of health. So Healthy Town designations are a great honor, and they're achieved through a competitive process annually. So that's just an important piece to remember. Sometimes there's some confusion around that. If you did apply last year, or if you were designated last year as a Healthy Town, this is something that you need to do every single year. The designation is to recognize the work you've done in a calendar year. So those of you who received those designations last year, you can go for it again this year. So why would a town want to become a healthy town? So first of all, you'll receive recognition for your community's hard work throughout the calendar year. We know that you guys are doing a lot, and we work with over 400 municipalities throughout the state. So we don't always get the opportunity to show all the hard work that you're doing. So this is a good way to be able to do that. Healthy town designees will also receive a sign for your town hall or municipal complex, and you'll be featured on the New Jersey Healthcare Quality Institute website. You're promoted through our media, through press releases and widespread social media campaign, highlighted in our newsletter, and featured in an article for the State League of Municipalities magazine and a QI press release. So all of these things are great to bring your towns to the forefront of New Jersey, making sure that people know all of the hard work that you're doing. And this year, for the first time, we are going to be hosting a Healthy Town reception. So that'll be another opportunity for you to come together with your colleagues, receive your award, your municipal sign, and then also have the chance to network and collaborate with other towns that have received the same designation. So being able to share best practices and maybe talk about your experiences with each other. So there are 3 Healthy Town designations. So Healthy Town is the highest level that you can be awarded. And these communities have well-established and engaged mayor's wellness committees that use research and local data, including the social determinants of health, to assess the health and wellness of their community. They collaborate with local partners to implement programming to reach health goals established for that year and successfully evaluate that programming. And there's also some sustainability plans in place. So that's kind of the gold standard. A Healthy Town to Watch is a community that's on your way to becoming a healthy town and have made a commitment to improving the health and wellness of your community. Along with key stakeholders, you've started to incorporate local data into programming and have identified ways to evaluate these programs. And then Healthy Town Up and Coming are communities that have made the decision to focus on health and wellness in their communities. You've started inviting important stakeholders to the table and offer healthy activity and education programming to your residents. So hopefully you can see how you can build off of these designations and how you can maybe take it to the next level if you were awarded one of these last year. Okay, so now we're going to dive into the application. So this will be the bulk of what we talk about today. I just want to go through the application, and we're going to go right through the website. So let me switch screens here. Show you guys how to access it. Okay, so you're going to go right to the New Jersey Healthcare Quality Institute website, and you can go to the Mayor's Wellness Campaign area and scroll down. And this is pretty much what we're going over here, just the basic information. We'll talk about this again, but the due date is January 31st at 5 p.m. and then we'll be announcing the winners on March 2nd. Okay, so we'll start with the application here. Okay, so we're starting with basic information. So gives us the opportunity to know each town. I'm sure this will surprise you, but I don't have the demographics memorized for all 500 municipalities in New Jersey. So we're just asking for a little bit of basic information here to help us understand your community and where you're coming from. You can provide contact information so that we can be in touch. You're going to give us the date of your last Mayor's Wellness Campaign participation pledge. If you do have questions about when the last time your mayor signed was, feel free to reach out to me and I can certainly provide that information to you. And then when your Mayor's Wellness Campaign was started, and then also on your municipal website. So that's just basic information there. So then we're just asking you about your community and your residents. Again, a little bit more about demographics, characteristics, and then availability of health and wellness opportunities, parks and recreation, sidewalks, safe streets, or anything else that you feel like really stands out about your community that you would want us to know. Okay. In our second question, we're looking for demonstrable research that you've completed to determine your community's health needs and how your programming addresses those needs. Any of you who I've had the chance to meet know that this is something we're really trying to incorporate into the Mayor's Wellness Campaign in general. We really want people to be focusing on localized data. I know that that's a challenge. Many of you are working with limited resources, but we want to see that you're really looking at the needs of your community. What kind of research did you do in your town? What did the research tell you? Did you include residents or maybe community groups in this research assessment or in the creation of your programs? And just kind of giving us an idea of how you determined what your local needs look like. So that's really what we're trying to capture there in question 2. Okay, and then so in our third question, we're really just wanting to know what was the result of all of that research and work that you did, and did you share it with your community partner? So just a little bit of insight into what were you able to bring those stakeholders to the table and provide them information that you gathered. And then in our fourth question, we're talking about collaboration. Again, this is a key component to being a successful, healthy town. We really want to know that you've involved all of the important players in your needs assessment process, in the development of your programs and event planning, and making sure that that all the diverse populations in your community are being included. So this question 5 is a new question this year. Those of you who maybe applied or are familiar with the program, this is something that we added in this year, and it's talking about the social determinants of health. This is a lens that we really want people to be thinking about when they're thinking about wellness in their town. I've provided a link there if you're not familiar, or if you're looking for some more information about the social determinants of health. And I really encourage you guys to take a look at that for your application, or just for the creation of the rest of your programming going forward. So there are 5 main areas of social determinants of health, and you'll see those at the bottom of that website. And in this question, I want to see towns choose one area and explain why you feel your town needs the most improvement in that area, and then also explain which area you feel your town is doing really well in. And definitely provide some information as to why you feel like those areas are the ones that you want to focus on. And then again, in question 6, we're looking at specific social determinants of health that your mayor's wellness campaign is trying to address. And again, social determinants of health is really looking at the societal and environmental aspects of health in your community. So of course we want people to eat healthy foods and to stay physically active and have opportunities to do that. But we're really looking for towns to think about health in a broader spectrum. Do you have jobs available to your communities? Are the streets safe? Or can people go outside? Or is there violence in the communities? So really thinking about health as a whole picture of how it affects people's day-to-day lives. Okay, so for question 6, we're just looking, 7, we're looking at how you promoted your Mayor's Wellness Campaign programs. So if you do have any social media campaigns, and you can provide us with that information, it's good for us to be able to go on and take a look at how you're using that, but also it gives us the information so that we can tag you or continue to share all of the work that you're doing. We really want to be able to help you to advertise programming. And we know that one of the big challenges to a lot of these programs and events, or even getting people involved in policy change, is that they may not know that these events are happening in your community. So by giving us some of that background information, we can better support you in advertising and marketing your programming. In question 8, we are looking for you to list and describe up to 10. That by no means means that you need to describe 10 programs, but as many as 10 programs that you feel were the most successful. So I would really focus on the events that you think are unique, that you think really made the biggest impact on your community. And that's gonna be an opportunity for you to let us know what the health goals that were addressed were, the target population, who, if anyone, sponsored or partnered with you on these events, the content of the program, and the cost, if you did have a cost to participate, and then location, attendance, and how your attendance is monitored, how participants can sign up, and how programs were evaluated. So I know that's a lot of information, and again, for 10 programs, that would be a lot, but we want to give you the opportunity to share with us what you've been doing over the last year. We know that you're doing a lot of hard work and providing a lot of opportunities to your community, so this is the place to be able to do that. You'll also see as we get further down the page that there's an opportunity for you to upload documents. So if you have flyers that you feel like all the information wasn't captured in the answer to this question, you can provide that. You can provide us with the surveys that you use to evaluate your programs. You can provide pictures from those events. So just make sure that you're labeling those so that we can see what they're from. And then in question 9, you're going to talk about programs that were directly hosted by your Mayor's Wellness Campaign. And so what this is really asking is, we know that most Mayor's Wellness campaigns are run by mostly volunteer groups. And so you may be partnering with other groups to promote programs. And so that's a good thing. That's what we want to see happening. But we're just wondering if you directly have organized events specifically through your Mayor's Wellness Campaign. And then for question 10, which of the programs involve direct input or presence of the mayor? We know that having your mayor's support is a huge indicator of success for these programs. So we just want to know if your mayor is participating in these events, or if they're simply giving you the resources and the support that you need to continue to move forward with those. Then for question 11, approximately how much money did your Mayor's Wellness Campaign spend on programming last year? I know that this can be kind of a tricky question because depending on where you're getting funding, if you're part of your town's recreation department or your health department, this can be a little bit confusing. But at your best estimate, if you can let us know what you're spending. Part of the reason why we ask this question is we know that funding and resources are always a challenge for towns, and we want to be able to have an understanding of what it's costing towns to provide this type of important programming so that we can better support you if possible. 12, so how many people participated in your Mayor's Wellness Campaign programs last year? Again, I know this might sound like a tough question to answer. I'd also encourage everyone to use these questions and this application as a guide for your 2020 programming. These are the types of questions that we hope that you're thinking about in the planning for what you're going to be doing next year. It's not always easy to show impact and evaluation of programs, but it's something that we're definitely trying to encourage everyone to think about. It's really important to be able to offer all of these programs and training, but if you aren't able to show the tangible impact that they're having on your community, it makes it challenging to continue to get the support for those programs. So that's why we're looking at number of people, and then that takes us right into question 13, which is how were your Mayor's Wellness Campaign programs evaluated? So like I mentioned earlier, you can certainly attach surveys or other evaluation tools that you use. We love to see those. And just as a side note, if you are going forward with programming for 2020 and you would like help with this piece of the programming, surveying or evaluating your programs, that's certainly something that I'm able to assist with. I think it's really important to be able to show what a value these programs bring to our communities, and there's ways to do that. So hopefully you guys have been doing that over this past year and you're able to share some of that information with us here. Along those same lines of showing impact, the 14th question is going to be asking about promotion of healthy behaviors. So were you able to measure that there was an increased physical activity, more healthy food consumption, or completion of advanced directives? Those are just some examples of things that you may have been able to promote with your programming throughout the year, but certainly there are others, and we're wondering, what your view of that is. 15 again is looking at impact, so describing positive changes that have occurred since the implementation of your Mayor's Wellness Campaign. If you feel like those goals that you maybe identified during your needs assessment were met, we want to hear about that. Did you increase participation in programming? Did you bring more community partners to the table? And anything else that you feel like was a positive change that has occurred since the implementation of your Mayor's Wellness Campaign. 16 is asking you to think about the future goals of your Mayor's Wellness Campaign. So do you already have plans in place for 2020? Have you thought about how those programs are going to improve your town's social determinants of health? So describing your broader vision for the future for your town. So that can be different depending on your town or the size of your Mayor's Wellness Campaign, or what you really choose to focus on. So just looking at what your 2020 goals are. For number 17, we are looking to assess which of the Mayor's Wellness Campaign programs you would recommend to other municipalities to try out in their towns. Hopefully all of you have used our toolkit in the past, and as you know, we're always looking to make things easier for our Mayor's Wellness Campaign town. So if you have already done the hard work and created new programming or found something to be really successful in your town, we're just wondering if you would be willing to share that information with other municipalities. We think it's a really good opportunity to collaborate. We have so many small towns doing a lot of good work, and giving people the opportunity to share best practices is something we want to focus on this year as well. So if you have any programs that you feel like you'd be willing to share with other towns and maybe provide a little bit of support around that, we're just interested in hearing about that. And then question 18 is more about what Mayor's Wellness Campaign staff can do for you. So as you know, we do the toolkits, we have the newsletter, we send out blast emails, you visit us at the League of Municipalities conference, but are there things that you're not getting from your participation with the Quality Institute that you feel like would be helpful? Just one example, last year, the feedback for this question was that people wanted more opportunities to collaborate on a regional level. And so this year we received a grant to work with Bergen County specifically to help them to create a regional committee meeting, and that's taking place in March of this year. So this feedback really helps us to guide our program goals for the year. So anything that you feel like could be improved on our end, we're very interested to hear about that here. And then again, this is where you're going to just provide any of those documents. I think the things that are really useful, again, are anything that you use to evaluate your programming. We like to see the pictures of people in your community. We can, if you do upload those, you'll likely see that in our marketing tools, and we can share those on social media. So always looking to highlight all the work that you guys are doing. And so then the one thing I want to just mention about the application itself is that this is a fillable form. You can see here at the bottom that many of them do have character limits, not all of them do. So my recommendation would be to copy and paste these questions into a Word document so that you're able to make sure that you're answering within those character constraints. They're not word constraints. So just make sure to be mindful of that. And then also you can save and work on the website, but honestly, I never trust that. So I would definitely do this in a Word document. And if you have any trouble at all submitting this application, please feel free to reach out to me at any time if you're having technical difficulties around that. So that is the actual application itself. And now I'm going to switch back over and we're going to look at the rubric. Actually, let's pause here. I know it's a lot, and I know I'm a quick talker. So I'm going to attempt to unmute all of you. We'll see if that works out. It wasn't working for everyone before. Does anyone have any questions at this point? I don't hear any, but that doesn't necessarily mean anything. Oh, any questions? All right, well, you can also type them into the question and answer box, like I mentioned at the bottom, and we'll make sure we get to all of those before we're done. So I will go on to the rubric here. So again, same spot, just taking you through the website so that you can see the rubric is going to be here, and this is a downloadable form. Okay, so this rubric is really a reference so that you can understand what I'm going to be looking at when I'm evaluating your application. The rubric does highlight the importance of addressing health broadly to incorporate social and economic opportunities that help shape health and well-being. So that's what we had talked about earlier as well. As such, the rubric does align with the Robert Wood Johnson Foundation's culture of health criteria, and we've modified it to meet the needs of our program here. It's divided into 6 main categories, which will be on the left-hand side as you go down, but defining health broadly, measurement and data sharing, health and equity, procurement of resources, collaboration, and then commitment to sustainability. And so, slide here. And so you can see all of these, and in each category, there are subcategories as well. And then we'll be giving a score of 1 to 3 in each subcategory, and then totaling at the end. So, so the total score will be 60 points. And if you did submit an application last year, you'll receive an extra 2 bonus points on your application for this year as a recognition of your continued commitment to your local Mayor's Wellness campaign. So as we mentioned earlier, there'll be 3 different designations. So Healthy Town to Watch, and then Healthy Town Up and Coming. There's no set number of towns. We're not looking to fill any quotas with these. We're really just looking objectively at the work that you've done for the year and then deciding who fits into which category. And just as a reminder, this is just for references purposes only, and it's just what we'll be using to identify the Healthy Town designees at the end. So that, I know that's quick and a lot. Are there any questions? Just want to make sure that it's not that you don't have questions and that it's not that you aren't able to ask them, because it's showing me that you're muted here, but you may be muting yourself. Oh, Margaret, I see a hand. Margaret, can you hear me or respond? Okay. Okay, so Margaret's asking if we have a Healthy Town to Watch status and we apply again, would it remain? So good question, Margaret. So these are annual designations. So you have the opportunity to make the case that you should be designated as the next step up. So your last year's designation does not relate to your designation from this year. This application is annual. I'm sure that this isn't the case in Scotch Plains, but in theory, you could have had a great year last year and then this year not done any wellness programs at all. And then, we'd be using that to assess your designation for the year. So your 2018 status does not affect your 2019 status. We're really looking at this on an annual basis and asking people to let us know what they've done for 2019. And that's what we'll be using to designate for 2019. Hopefully that answers your question, Margaret. And if not, you can type in another question. I'm not, like I said, it's hard for me to tell from this end who is muting themselves or if they're stuck unmuting. So please feel free to use the question and answer box, which you can find at the bottom. It's one of the options of on your screen there. And I'm going to give people one more second to just see if they have any other questions.
Can you hear me?
Yes.
Quick question. You talked about a reception, which is the first time that you guys are going to have that. My question is, when is that? And even if you're not in one of the top categories, if you don't, get the highest level, are you still going to invite towns so we have a chance to meet other people?
That's a great question. You know what? I think it will ultimately depend on how many designees we have, if I'm being honest. So that's going to be in April, and the intent of it is for the designation awardees and to be able to network amongst themselves and be able to meet each other and talk there. But that's a good point, that it might be beneficial, especially for towns if they did apply and maybe weren't awarded. That might be a good opportunity for those towns to be able to network with towns that were successful. So I guess the answer is that I don't have a firm answer on that yet, but I like that idea, and it's definitely something we can consider depending on the numbers.
Okay, great, thanks.
Yeah, thanks, Stacy. Any other questions at this point? Okay. Hoping that it's just because we don't have questions and not a technical thing, but we'll keep it moving here, and you can always email me if needed. Okay, so here is just some photos from our last year's winners. These are just some of the programs and photos that were submitted. So we have on top left, we have Westwood, so the 2018 Healthy Town. They hosted a Mayor's Walk, so you can see that group in their Mayor's Walk. And then top right, we have Bergenfield, and they were also a Healthy Town in 2018, and they're participating in a fitness class, and that's their mayor. right in front there. And then on the bottom, we have Ridgewood, which was a healthy town to watch, and they hosted a stigma-free walk to raise awareness about mental health issues. So I think that, you know, while these are all great programs, I think the stigma-free walk is a good example of something that incorporates something that we maybe don't traditionally think of health and wellness, really thinking about the whole person and recognizing that mental health is also part of our health and well-being, and creating a community event around that. So those are just some nice ideas from last year. And so what we're going to do is not click through here. It's not okay. Questions. Okay, so the last thing that we're going to do on this webinar is walk through one of our new tools. So whenever we do a webinar, we do like to include a new tool to make sure that you guys are aware of the opportunities that you have for new ideas of programming. So I'm going to go back to the website and just show you how you would access our toolkit if you haven't before, and then show you about this new idea that I think is a pretty cool one. So to access our toolkit, hopefully you guys have done this previously, but you would go to the Mayor's Wellness Campaign site. You can click tools, and then there are 4 different buckets for the tools, and the one that we're going to be talking about today is in physical health and nutrition. So we have quite a few here. A lot of these have been around for a while, but we have a new tool that we just released this year, which is our fitness crawl. And so this is I think that this is just a really cool idea. Maybe won't be as popular as your traditional bar crawl, but hopefully you can change that in your towns. So the idea is to give your community the opportunity to experience fitness classes with a fitness crawl. So it would be a series of fitness establishments and programs that are visited by the group of participants. Like I said, similar to a bar crawl, but obviously healthier, and participants attend different fitness related venues while exploring your community. So this is really has multiple benefits. People are getting access to different fitness classes or opportunities. They're learning about businesses that might be in their town that maybe they haven't patroned yet. And then you're also, like I said, getting the whole community involved by using your business community as well as your residents. So increasing physical activity, and then encourages people to get out and explore their towns. So we know that regular exercise reduces the risk of chronic disease and can increase your life expectancy. So this is a great way to get your community active. The first step to creating a fitness crawl would be to get connected with your local fitness establishment. So this is a really good opportunity for them. It does provide them with free advertising if they choose to do it that way. So you can build those relationships, and gives your businesses opportunities to become partners with your Mayor's Wellness Campaign, hopefully gets them on board, and maybe they will be partners for other events going forward. And also the businesses will be the experts on advertising and your logistics for your event. So always good to have them at the table. So then you're going to want to plan your details, such as date and time. Are you going to be able to offer incentives to participants? A great incentive would be a free or reduced price membership to one of these establishments that you're working with. So always has good incentives for both. Figuring out what route your crawl will be, making sure that it makes sense. You don't want people walking all over the town in odd directions. And then how are you going to promote the event? So another good time to collaborate with your Mayor's Wellness Campaign partners, and obviously delegate the different aspects of that planning process. And I mention that because, like I said before, we know that many of you are working with limited resources, and just always reminding you to, field out whatever work you can so that you can have more bandwidth. And then, so the other thing that you're going to want to be able to do is show the impact. Like I said, we're really looking for towns to be able to show the success of their programs and evaluate them when they're done. So one way to do that for this would be to develop a survey and do a baseline. So asking people how often they exercise, which of these establishments they've been to before, how many did they know existed in their town. And then you could ask the same question same questions after your fitness crawl, so that you can determine what was learned and gained through your program. So again, this is something that I am more than happy to help you do, whether it's for a program like the fitness crawl or any of your other programs. I really encourage everybody to think about evaluating their programs and how they're impacting. So This fitness crawl is something that Rawway did in 2018 during their Winter Wonderland Community Day, and it promoted local opportunities for residents to get fit. So you may have people that just were not aware of what they had in their town. So I think that this is just a win-win for all of your different partners in your community. And so this is just one of the tools. This is everything that we just talked about, but it really walks you through the entire process. And if you haven't used our toolkit before, I really encourage you to take a look and think about implementing some of this programming for your 2020 activities. Okay. Any other questions about your application, the Healthy Town process? I know that you may not have had a chance to necessarily go through the application at this point. So if you don't have questions, you of course can reach out to me at any point. Just want to make sure it doesn't look like anybody's trying to wave me down here. Okay. I will stay on for a few more minutes, just in case somebody does want to ask some questions. I should have mentioned this in the beginning, but this was recorded, so I will be posting it in case you have colleagues or if you want to revisit anything that we talked about. And you are all always more than welcome to reach out to me if you have any concerns or if you want any guidance on your process. And thank you guys all for attending today. So I'll leave my information up here and I'll hang out for a little bit in case anybody has any questions. Everybody have a good day.